In a slightly modified position of the transducer, orientating from the shoulder to the umbilicus, we focus on the gallbladder, duodenum, inferior vena cava, right renal artery, part of the portal vein, and the liver. The gallbladder can be best examined via subcostal approach. From a median position, take a deep breath. We orientate under the lower surface of the liver, see the arrow, until we can delineate the gallbladder. You can nicely see the gallbladder in a longitudinal plane and transversal plane for evaluation of the whole volume. The evaluation of the gallbladder should be done after a fasting period of, let's say, 6 to 8 hours. Take a breath. And even after this fasting period, sometimes, breathe normal, hidden stones and sludge cannot be delineated in one position. Therefore, we recommend, please stand up in the standing position. Elevate the arm above your head. Take a breath. In the standing position, we start the longitudinal and transversal orientated examination. And additionally, we perform some vibrations to delineate mobile stones. It is of importance to examine also in a standing position in patients without known stones for better visualization and for stones detected in the infundibulum to characterize if those stones are mobile. For the examination of the gallbladder under stressful conditions, perhaps during night shift at 3 o'clock, you position the patient as described for the liver hilum in a slightly left lateral position. Take a breath. The leading structure is the lower edge of the liver, next to the arrow. You follow in the middle of the screen the lower edge of the liver, and you nicely display the gallbladder lumen. The gallbladder is best examined. Take a deep breath. From subcostally as described. During a night shift under stress situation, breathe normal. The intercostal approach allows to analyze the gallbladder nicely, the bile ducts as seen with the marker, the portal vein, the right liver vein, and next to the transducer, take a little breath, stop, the costodiaphragmatic lateral part of the pleura for exclusion of pleural effusion. This is of importance to make fast clinical decision in a patient under difficult conditions, perhaps during the night shift, to have with one transducer position very important information at one glance. The evaluation of the intrahepatic bile ducts is best performed with a high-frequency transducer, but also with a transabdominal transducer, curved array, take a breath, and using color, Doppler imaging, the intrahepatic bile ducts can be displayed, as shown next to the marker and the arrow. For the evaluation of the intrahepatic bile ducts, a high-frequency transducer is useful. The intercostal approach, take a breath, allows nice delineation of the intrahepatic bile ducts.